welcome to Senior Circuit. I'm Ashley Speliotis, Interim Director at the Council on Aging. It's nice to meet everyone. If I haven't met you yet in these months that I've been with the Council on Aging. Today we have a very special guest. We have Dr. Gerweck from the Cambridge Health Alliance. The coronavirus has really touched all of us and affected us all in so many ways, and we've heard so many great questions from all of you calling in to the Council on Aging, and we wanted to give this opportunity to Dr. Gerweck to be with us and help us get a little bit of our questions answered. So thank you for being here, Dr. Gerweck.
Well, thank you. I really appreciate you inviting me. Very important topic, so I hope I can help out.
Yes, you're a geriatrician. Would you like to talk a little bit about what that is and where you practice medicine?
Yeah, so I practice medicine here in East Cambridge with the Cambridge Health Alliance. I've been here for 10 years now. My specialty is in geriatrics, which means I take care of older folks, but I also specialize in family medicine. So really I see babies up to 100-year-olds. Yeah, very rewarding.
Thank you. Yeah, and we've had many questions, like I mentioned, from older adults in Somerville and some in Cambridge calling in, and I think the coronavirus is on all of our minds, and especially with the recent surge we have been seeing. Do you believe the numbers are still rising?
Good question, and there are different ways to, depends on what numbers you look at, I suppose. In terms of the daily rates and infection rates here in the state, it varies. Each day is a little different, but the problem is it's varying way up here. So are we in the middle of a surge? Absolutely. You know, if it varies down here, that's great, but when it's always varying up here, that's bad. So ever since Thanksgiving, really, we've been in, a second surge or a second wave. Yeah. It's interesting too. The rates of infection are important, but also we tend to look at mortality rates. And last December, if we look at it nationwide, the mortality, that was the deadliest month we've had since April. So the second deadliest. So the nation as a whole is still having this surge as well.
Yeah. Every day we see on the news the mortality rate, and it's just a constant reminder of how serious it is and really how tough to treat it could be. And after all these months, are there new treatments out there? Or are there treatments that are being used that can decrease the mortality rate?
Very good question. And we could spend a lot of time talking about the various treatments. I think the most important thing, though, is that there are a few treatments out there. That is, treatments meaning people who already have the virus, so you're trying to cure them, but none of them are silver bullets. None of them are magic. And that's why, as we'll probably talk a little bit later, vaccines are going to be very important. Having said that, though, you may hear that in the hospital, some people are treated with a steroid called dexamethasone. Does that decrease mortality rates? Maybe a little bit for some people, depending on the context. So not magic. There's another medicine called remdesivir. The latest study suggests it may not be as helpful as we had hoped. Now, those are the two medicines that are being used fairly frequently in the hospital. There are I was looking at this earlier today, there are over 26 other medicines that are being investigated. Some of them are brand new medicines, some are old repurposed medicines. Time will tell how effective they are.
Yeah. Right. But I think there is a lot of recommendations out there of what we can do for prevention, like wearing our mask. And what else do you advise older adults to do to keep us safe while we're in the community?
For sure. And it's definitely worth remembering that this virus will spread like wildfire if we don't practice some measures of prevention. Does wearing a mask work? Absolutely, especially if both people that are at all close to each other are both wearing masks, can be quite effective. Typical hand hygiene is good, and then social distancing. If it weren't for these measures, we'd be actually in a lot more dire consequences, worse state than we are now.
That's right. Yeah. Just until you mentioned like that silver bullet that everybody's looking for, but isn't quite there yet. But there is
No.
a little bit of hope, I think you could say, with the vaccine out there. And
Uh-huh.
why are you in support? I don't know if you've had the vaccine yet, or why would you be planning yourself to get the vaccine?
For sure. So yeah, I've actually had both doses. I'm about 2 weeks out, I think, from my second dose. Just me personally, um, I got the vaccine, both doses, and to be honest, I really didn't have any side effects whatsoever, which is fantastic. A little bit of muscle ache, maybe a little bit of bruising there, and that was it. Am I a proponent of the vaccine? For sure, for sure. And sort of in a nutshell, it's because thus far it very much appears to be both safe and effective. The CDC says that, mass.gov says that, and when I look at the data, it really supports those conclusions.
Yeah, I think we've been hearing from a lot of people some concerns about it, and some concerns due to the side effects of the vaccine. Are there any known side effects of receiving the vaccine?
For sure. And it's, just like other vaccines, there can be side effects. And we generally think of them as the short-term side effects, especially with this particular vaccine because it's so new. So the side effects tend to range, or common side effects, I would say, are, a little muscle ache there after the shot. Some people will get some fatigue, a little bit of headache, perhaps a low-grade fever, some muscle aches. So almost like a mild kind of flu-like symptoms. Again, I got both my vaccines, as have all my colleagues. We're just smiling. Yeah, I haven't heard of anybody getting a bad reaction. Of course, you'll hear in the media, you'll hear that some people have had some bad reactions. Have you heard about the concern for anaphylaxis at all? I don't know if the folks over there have.
Yeah, we've heard a lot of like what people are saying in the news. They're worried about the risk, or maybe that the vaccine has been developed fast. So there's some concern there. And I don't know if you can address is this vaccine really developed faster than other vaccines, or is that a reason to influence us in receiving the vaccine?
Right. Great question. And I would say the data continues to accumulate. So for example, in this country, there have been millions of people, I think over 4 million people that have been vaccinated already. And so that's even with not even considering the trials that have already taken place. So it really does seem to be an effective vaccine and safe, despite the fact that it was developed over a year. And I could understand people say, whoa, that's, are you taking shortcuts? What's going on here? Doesn't it take years to develop a vaccine? It's interesting, if we look at the development of the measles vaccine back in the 60s, that took 5 years. And so the fact that this took 1 year, is it exciting? Is it fascinating? Yeah. Is it surprising? Not really. We've come a long way in 60 years. If we could do it in 5 years, 60 years ago, yeah, we can do this in 1 year. Did they take shortcuts? No, they didn't, at least as best as I can tell. And I say that because the CDC is actually very transparent. So if you go to the CDC website or even the mass.gov website, it's very transparent how rigorous the studies were, how methodically they were done, and the primary way in which they accelerated the creation, the development, and the production of this vaccine is really they overlapped the various phases of the trials. So before one trial finishes, as long as the data looks promising, they were given the green light to go ahead to start the next trial. So they were able to really condense things while still not cutting corners. and they actually started developing the final product, the vaccine, before the final trial was completed. They got to go ahead to do that. So they were able to hit the ground running.
Right. So some time-saving measures, not so much shortcuts in the research, which is comforting to know when you're taking it, because like you mentioned before, like it must be a relief for you and your colleagues to go to work a little bit more, because you're facing, quite critically ill patients and seeing the effects on their families and yourselves.
That's right. That's right. The FDA and the CDC, they don't allow shortcuts. So it's not, they didn't do that. And so, yeah, it's really reassuring to know that.
Yeah. But as with all vaccines, it's not 100% effective. Can
Mhm.
you speak to how effective it could be, or how long it may keep us protected from the coronavirus?
Yes, yes, very important. You can pump out a vaccine really quickly. That's fantastic. But really, one of the major questions is, does it work? Um,
Mm.
so it looks like both vaccines that we have available to us right now are probably equally effective, and the rates of effectiveness are around 90 to 95%. There are some important questions that remain, though. What does it mean to be effective? Effective at what? And in this case, it means effective at preventing the person from developing symptoms of COVID. So it's a little different than saying that it's 95% effective at preventing COVID entirely, because we actually don't know that to be a fact yet. That we don't have that information yet. But 90 to 95% effective at preventing, the effects of COVID, preventing the symptoms of COVID.
Mhm.
The other question you asked is, how long does the effectiveness, how long does it last? Or durability is the term you might hear. Um, we don't know. And I guess that's one of the drawbacks of producing this so rapidly. And it's great that we're getting it out here. There is 2 weeks after the first dose, it's about 70% effective, is what the data looks like right now. 2 weeks to 4 weeks after the second dose, it appears to be about 90 to 95% effective. But say 3 months from now, 4 months from now, a year from now, is it still going to be effective? We don't know. We will. We'll know. We'll know, but we don't know yet.
Right. But it's another way to help in the overall fight of the coronavirus and the overall getting a few steps back to normal by each of us making that decision to go out and get our vaccine when our time comes for it.
It's the most important thing we can do, not just for ourselves. For example, I didn't get the vaccine just for myself. I got it for my patients, for my parents who are in their 70s, for my kids. I got it for my community, because every person who gets vaccinated helps us approach this concept of herd immunity. This idea, if we get enough folks vaccinated, the virus will have nowhere to go, and it will burn itself out. It will die out.
Mhm. Yeah, that would be an excellent wish for when that comes about. And
Oh, yeah.
until then, and if we are able to get our vaccines, I hear, and we have received many questions about what we do after. And is it kind of a signal that you can stop wearing your mask and stop being so cautious if you have given a vaccine or gotten a
Mm,
vaccine?
I only wish, right? It
Yeah.
seems intuitive. It seems logical that when you get the vaccine, you can stop the mask and stop the social distancing. Unfortunately, because we don't know if the vaccine prevents you from getting a mild form of COVID without symptoms and transmitting it to someone else, we don't know if that's actually possible. That still, the recommendation is to continue the mask, continue the social distancing.
Yeah, that's right. I think you mentioned as well that when you received the vaccine, you did it for your children and I'm not sure how old they are, but we've received lots of questions because what the media is telling us and research and science are telling us the vaccine is not approved for younger children. And what does that mean? There's been a lot of recommendations for many of our folks coming to the center not to be close with their grandchildren or wear a mask with their grandchildren. And what does it mean if our folks at the Council on Aging can receive the vaccine, but their grandchildren cannot?
Great question. Yeah, so one vaccine is approved for 16 years and older. The other vaccine is approved for folks that are 18 years and older. So yeah, what do we do about everybody younger than that? And can they still transmit the vaccine to other people? Yeah, that is a concern. You know, some positive things are that we know that if kids get the virus, on the whole, they tend to deal with it much, much better than older folks. That's true for both kids and younger adults. So that's a positive. But in terms of visiting their grandparents, you know, soon enough, hopefully starting February 1st, when phase 2 starts, hopefully older folks will be able to get in line and start getting vaccines. So that's also a positive. But having said that, should the grandkids still wear a mask if they're around their grandparents? Yeah, they should.
Yeah, so we have more hope coming to us, but we just still have to remember to be cautious and follow all the guidelines.
Yeah.
I think just to shift the conversation a little bit, because of hearing about social distancing and other precautions that have been in place, we also hear from quite a few folks at the Council on Aging that there's some hesitancy to seek medical care during this coronavirus time, and a little bit of fear of going to the hospital or going to a doctor's office. Is that something that you found as well?
Yes, I have. We have, and it's understandable that people, you know, they're hearing that they should socially distance. They're hearing that they need to play it safe, and that's all true. But there are more things out there than the virus. There are also, you know, people may have chronic conditions, high blood pressure, diabetes, arthritis, various things. And just because there's a pandemic out there doesn't mean these chronic conditions vanish. They're still there, and they still need to be managed.
Yeah. And what have some of the precautions in your office or your practice, what precautions have you taken to keep people safe during the coronavirus?
For sure. So before we even have a person come in, we like to determine whether it is safe for them to come in or whether the management pieces that we'd like to accomplish can be done over the phone. But if a person does come in, they'll be asked some questions when they first enter. We do ask that they wear a mask. Everybody here is wearing a mask, and all staff and providers that have any face-to-face exposure with our patients are not just wearing a mask, but also a face shield and practicing hand hygiene. So we definitely take this serious and wear our PPE and take the necessary precautions.
Yeah, we've gotten a few questions over the last couple of days, and people are questioning, you know, they've gotten used to their face mask, and now they see people wearing two face masks or the face mask and the shield. What do you recommend for people, say, when they're going to the grocery store or going for a walk outside? What do you recommend?
Yeah, the most important thing is just wear some type of face mask and avoid anybody who is not wearing a face mask. So regardless of the type of face mask, are there differences between an N95, a surgical mask, and a cloth, double cloth mask? There are some differences in terms of their effectiveness, but by far the most important thing is that if all parties, all persons in a room or wherever it may be are wearing a face mask, that decreases the rates of transmission tremendously.
Yeah.
As far as face shields, if you like them, wear them. Generally speaking, it's not necessary, for the general public.
Yeah, I know you've mentioned mentioned quite a few times, for both people to be wearing a mask is important. Can you speak a little bit more to that, and to say what happens if you are in a place where one person isn't wearing a mask? What should you do?
For sure. So in general, we want to avoid close-knit sort of enclosures. So if that can be avoided, that's the first step. If it can't be avoided, then you want to distance yourself from the other people by 6 feet if possible, if you're in the same room. And then, yeah, the third piece to this is really all people should be wearing a face mask. And that's been shown in studies that if, one person wears a cloth face mask, maybe they'll decrease the rate of transmission by a third. But if both of them do it, it's beyond 70% effective. So if somebody else is not wearing it, you have to weigh your options. Maybe you don't need to be there. Maybe they don't need to be there. Maybe you could offer them a face mask. So there are nice, polite ways to probably accomplish what you need to do.
Yeah, because it sounds like, as with so many things in the world, that it's really a team effort in combating the virus, and it's every little part that we can do would really help one another. So each of us, taking the responsibility to wear the face mask when our time comes for the vaccine, if we choose to get it, to receive it, and really helping out ourselves and our neighbors and our families.
Absolutely. I mean, this is really an amazing thing. We're being attacked by something that we can't even see. But can we overcome this? We can, but it absolutely will require a group effort, and I think we'll rise to the occasion.
Yeah. I think you're right as well. And with that, I would just like to say thank you so much for joining us on Senior Circuit, and to all of you out there, thanks for joining us this month, and we'll see you next month. Thank you.
Well, thank you. Have a good day.